Hi, everyone, and welcome to the Cancer Education Series. I'm Dick Deming. I'm Medical Director of MercyOne Cancer Center and the founder of Above and Beyond Cancer. Our Cancer Education Series is brought to you as a collaboration from MercyOne Cancer Center and Above and Beyond Cancer, and it is brought to you, sponsored in part by a grant from the Iowa Cancer Consortium. And I want to welcome Jay Heverlote tonight. So Jay is a doctor of acupuncture and Chinese medicine. We're going to learn what that's all about and also the role that acupuncture and Chinese medicine can play in cancer care. So welcome, Jay.
Thank you. Happy to be here.
It's great to have you. Tell me a little bit about yourself. So where did you grow up?
I grew up here in Norwalk, in Iowa. So 1990, finished high school. Left for the service, joined the service, traveled the world a bit.
Great. Thank you for your service.
Thank you. And thank you for yours.
So we were chatting a little bit before. So Jay was in the Air Force. I was a Navy doc.
Yeah.
And your Air Force experience, you got some international travel with that?
I did. I was in Europe. I was in the Middle East, and then California and around the States a little bit. So yeah.
Okay. And I think you told me you spent 4 years there, and
Yep.
then went to California to pursue some dreams.
I did. Yeah.
Uh-huh.
So I ended up in San Francisco. Got out of the service there and studied music for a couple of years there, about 3 or 4 years, and then found my way to Chinese medicine through that. So
Yeah.
yeah.
And you were telling me that maybe your first exposure to Chinese medicine was as a patient.
Correct. Yeah, I had a back injury playing some golf, and I'm not a golfer, so I had an acute sciatic problem. It was pretty severe. It took me out of work for a couple months, and the only relief I found was going to the Chinese medicine school to get acupuncture. And I thought, instead of looking for a gig every weekend, I might want to go back to school.
Yeah. And when you're living in the San Francisco area,
hmm
finding an acupuncture specialist is not difficult.
Oh, there's plenty of them.
Yeah.
Yeah. There's you have Chinatown there. You have the whole Bay Area. There's 4 colleges there. So yeah, quite a few students and quite a few practitioners.
So maybe tell me just a little bit about your first experience as a patient with acupuncture. What were your expectations going in? What were your maybe reservations? And how was that first interaction?
Yeah, I went in on a recommendation of a friend. I didn't know anything about it. I didn't know what I was getting into. Um, and I went in and the student did the intake. It was just me and the student, the 3rd-year student. So we went through all the categories that we go through, and I didn't know what he seemed to be asking me a lot of questions. And then the doctor came in, a Chinese fellow, and he did his intake and did his diagnosis, and then they did the treatment. I didn't think it was too bad. I didn't feel any pain. The needles were fine. And then afterwards, they brought out 2 bags of herbs to help treat the condition as well. And that was kind of strange because there were all these strange herbs in these bags, and I had to get the special pot, and I had to go home and cook them and drink them. And I went back quite a few times and it just kept getting better, and it kept getting better. And I thought, there's something to this, so it was interesting.
And then at what point in your life did you decide that you wanted to pursue it as a profession?
It was shortly after that. I think after I got better, I kind of got back to work. I was doing good. I'd already studying the Chinese language, so I had an experience with the language and started studying Chinese philosophy. So the philosophy kind of led me to it. And then Chinese medicine, I started looking into it, and the foundations of it is so culturally deep over there. It's tied in with everything. It's been going on for 5,000 years. So the poetry, the music, the medicine, it's all tied together. The martial arts, it's everything. It's a way of life, really. And so I was really intrigued by it. And the whole foundation of it is that it's about living in harmony with nature. So I think if you start your foundation with that, that's pretty amazing.
Mm-hmm.
And I was like, well, that seems like a really good place to go. So
tell me a little bit about your education. What's the education process to get to a doctor of acupuncture and Chinese medicine?
Yeah, you have to, so you have an undergrad, 4-year undergraduate, and usually most people do theirs with their science prereqs like biology, anatomy, physiology, chemistry, all your Western core courses. So 4-year undergraduate in science, and then you go to a master's program from there. And when I started going to school, that's all they had was master level program. So you would spend, it's a 4-year program, but you can do the accelerated. You do your clinical internships, during that program. So you're in the clinic for 3 years of that, seeing patients. And now they have doctorate programs. So as I got out, I was able to pursue, I opened my clinic first, and then they came out with doctorate programs, and I was able to get my doctorate after that through school in San Diego.
So back to your your college and your master's. At what point do you get into the Chinese philosophies of, Confucius and Lao Tzu and the Tao Te Ching, and where is that in the undergrad? Is that in the graduate?
It's in the graduate program, yeah. So in the undergraduate program, I personally got into it. It was the Tao Te Ching, it was Lao Tzu. Those books intrigued me and really drew me to it. So when I got into graduate school, it's nice to see that those were part of the curriculum. You were doing Tai Chi as part of your curriculum. You were doing Chinese medical massage, which is Tui Na. You were studying things like the Tao Te Ching, right? So it was pretty amazing.
And then obviously you learn the science and the technique of both acupuncture and herbs. And
Right.
So before we talk about the individual practices, what would be some of the other types of treatments besides acupuncture and herbal therapy that you would classify as Chinese medicine?
Yeah, that's a great question. So what is Chinese medicine? A lot of
Yes.
people will hear what is it? So you can kind of you understand what the techniques are that we use, and then you understand what the lifestyle of it is. So some of the techniques we use are acupuncture, cupping, scraping, which is gua sha tool, Tui Na, which is Chinese medical massage. We do I Jing Jing, which is like maybe physical therapy exercises, Tai Chi, Qigong, meditation, food therapy we do. What else do we do? Herbal therapy, lifestyle counseling. So all of these put together treat a wide variety. It's a whole healthcare system, that's been around for 5,000 years. So the doctors in the past 3,000-4,000 years have been writing books on all the conditions, that they've seen, and the extent of what they can treat is really amazing,
So when someone comes to see you, what sort of an intake do you do? So, as a Western trained doctor, we do the history and physical examination.
Yeah.
The history is obviously the history of their medical condition, but then the past medical history and et cetera. What's sort of the format by which you do your initial intake?
So this has been developed. If you go back and read, the history of Chinese medicine, this has been developed over thousands of years. So they keep adding on to it. And that's the thing about Chinese medicine is the reason I practice 3,000 years later in Iowa is because it still applies. The human body hasn't changed. The things that they're treating haven't changed. It's the way disease manifests in the body. So they go through the 4 major pillars are looking, listening, smelling, and palpation, right? So we go looking as you observe the patient. One of the things that Chinese medicine is amazing at is understanding the microcosm within the macrocosm, right? So the idea is that what happens outside of us also happens inside of us, right? So inside we have our own universe, our own weather that's happening, and it's connected to the outside, right? So looking at a patient, they can see the interconnectivity of something. When I see something about a patient appearing on their face, I can tell which organ systems are in relation, right? So if you have a patient come in with a rash around this area, maybe stomach problems, right? Or if they have eczema here, maybe lung problems, right? Or ear problems, might be connected to the kidneys. So there's this looking that you can already start diagnosing, right? They say in Chinese medicine that a proficient doctor has a patient 90% diagnosed from the front door to their desk, because you can start to chip away at your diagnosis before they even get to you, right? So you have looking, you have listening is the interrogation part, right? You're asking questions. You go through 14 different categories. You're going through body temperatures, taste sensations, bowel movements, excretions, sleep, emotions, pain, all of these categories, right? And we break all those down. And then you have palpation, and this is where you're palpating the channels of the body, right? So the acupuncture channels, there's 14 major channels where the acupuncture points are. We have 72 internal pathways that we work with. So you might palpate, the pain area. You may palpate the organ systems. You may palpate the hands, the feet, to help further your diagnosis. And then the last one is smelling. So a patient might have a certain smell to them, and that means certain things in our medicine, right? That leads us to certain diagnosis. To understand what we're diagnosing is patterns. We're looking at patterns, right? So this means the collection of all this information. We also look at tongue and pulse, right? Those are all part of looking and palpations.
And you said tongue and pulse?
Yeah. So the tongue is a map to the interior, right? So if you Google Chinese tongue diagnosis, you'll see the map that we use. And different parts of the tongue relate to different organ systems. So the tip relates to the heart. The space behind that relates to the lungs, with the sides of the gallbladder and the spleen. Stomach and spleen. The middle is liver, gallbladder, back is kidney. So we look at what's happening on the tongue. Then we look at the pulses. There's 27 different pulse types that we have, and you can have combinations of pulses. So we can tell the organ systems through the pulse. So you put all these symptoms together, and you start to see patterns evolving. These patterns will dictate what imbalances are in which organ systems, right? And that will lead you to your diagnosis, which will lead you to your treatment principles, and so forth.
And are the names of the diagnoses, do they correspond to Western diagnoses, or do they have different?
Yeah, completely different language. So I think that's why Chinese medicine is still so strong, because they're treating elements of nature, actually. So I treat wind, I treat cold, I treat heat, I treat damp, I treat dryness, and these manifest in the body in completely different ways. So it's the idea that what happens in the exterior also happens in the interior of the body. So where we have dry in the elements, we also have dry within us. And that might be dry skin, it might be constipation, it might be dry eyes, it might be any kind of dryness we see. We have heat, which can be hot flashes, or it could be sweating, or it could be any type of heat sensation in the body. So these are the things you're actually treating in the body. We're regulating pretty much the weather of the body, right?
And when you get to something like a very specific disease, and let's just say high blood pressure, or we'll get into cancer, but let's leave cancer to the side for a little bit. And let's say somebody has what we would call chronic obstructive lung disease, has a history of smoking, no longer smokes, but has a lot of lung damage, and has shortness of breath and cough. And in the Western world, we'd do a chest x-ray and we'd see the blebs and bullae in the lung, and with the history and the symptoms, we would call it a COPD, chronic obstructive pulmonary disease. What would be a similar, what would be the analogy, or what sort of terms would you use to describe that patient? And then how would you try to get the weather and alignment, the internal weather, to help manage their symptoms?
Yeah.
If not cure the disease.
Right. Yeah, you see, so in China, I work as a general practitioner, so I see all different types of patients come in. I see a lot of COPD patients come in. In China, it's something they treat quite frequently, because with the pollution and the smoking over there is pretty severe. So you have doctors that would just specialize over there in pulmonary disorders, or you have doctors that just specialize in cardio disorders. And what you see is we treat things like excess phlegm, blood stagnation, qi stagnation, and we talk about the word qi. We see excess and deficiency, right? Is that the lungs in excess, or the lungs deficient in something? Then we can also see dryness in there, right? So this would be if the patient comes in. One of the important things is that they always come in with a Western diagnosis like this, and we need to translate that into a Chinese medicine diagnosis, because that's what I practice, right? I'm not necessarily treating COPD. I'm treating the patient, right? And so when they come in, how are they manifesting? I might have 5 different patients with the same Western diagnosis, but I give 5 different treatments to them because they all manifest it differently, right? So most often you're going to see obstruction of the chest with phlegm, mucus. It may be blood streaked, so there might be blood stagnation. They might have wheezing. They might have weak lungs, so we can strengthen the lungs. We can move the blood. And there's herbs we can use for that. There's foods we can use for that. Acupuncture we can use for that. Tai Chi, Qigong. Qigong is a way that we use the lungs. The lungs are considered the sea of Qi, right? So in Chinese medicine, they have all these classic sayings. They're called statements of fact. Since the lungs, Qi, we might as well just talk about the word Qi. So there's a lot of words we don't translate because they don't have an English translation. So we use the Chinese word. Qi, which we've all kind of heard of, maybe loosely translated as energy, right? But really, it goes way deeper than that. And it's very cultural understanding. When you talk to a Chinese person, they understand Qi instantly, what you mean. Not only, if we look at the Chinese character, the top half of the character means a gaseous element, like oxygen. The bottom half of the character means grain of rice. So it gives us this idea that the air we breathe and the food we eat gives us life force. It gives us Qi. Everything in our world has Qi, right? Everything has a life force to it. It's alive. So we build that Qi through what we eat and the air we breathe. So, and that governs the body, and the lungs control that.
Yeah. So, and correct me if I'm wrong, but you're trying to restore balance, and you're trying to improve kind of well-being. You're not so much focused on, so in the Western world, we don't believe there's a cure for COPD,
Right.
that there's management of the disease. Other diseases, and we can talk about cancer, we think that there are ways of curing certain cancers, meaning eradicating it. But some chronic conditions like COPD, we think that after 50 years of smoking and lung damage, that we just don't believe there's a way of reversing all of that and curing it. So it's a matter of how do we manage and improve quality of life and well-being, and healing, even though it's not going to be curing the disease. So what would be some of the Chinese medicine techniques you would use to treat? And you've already told me that not every patient with COPD is the same, and the treatments might not be the same. But maybe give me a characteristic, a classic patient, a common type of patient that you would see, and how you would then formulate a course of treatment.
Okay. Yeah. So we also look the same way. The prognosis of a disease may be curable, may not be curable. You may just be giving some kind of palliative care to it, improving quality of life, right? If we can improve 50%, that's 50%. If we can improve 20%, that's an improvement as well. So we look at how can we treat this patient? If this patient comes in, then we start maybe with a diet, right? What is the person eating? We don't want to cause more obstruction. So we don't want foods that are inflammatory in the body. We don't want foods that are going to cause more mucus in the body, right? So we look at the food therapy in Chinese medicine is probably, food and herbs are probably the beginning, the foundation of it. And that goes back 5,000, 6,000 years. So we're looking at what do foods do in the body to us? Not necessarily the chemical makeup of the food, but how does it happen in the body? What does it do to it? Does it dry it out? Does it moisten it? Does it heat it up? Does it cool it? Does it give it energy? Does it slow it down? So we say that we look at the 5 flavors of the food, right? Sour, salty, spicy, bitter, pungent, and we try to balance these. So if one patient is having too much mucus, too much phlegm, then foods that are sweet slow down digestion. So we don't want to use those types of foods. So we might look at their diet and say, how can we adjust your diet to be less phlegm producing, right? Then we can also look at herbs. Well, what kind of herbs promote blood circulation? What herbs promote oxygen, benefit the lungs? So ginseng, we're lucky now because in China they do lots of research at the universities on the herbs there. they have thousands upon thousands of items in the materia medica, and doctors for thousands of years have written formulations for all these patterns, right? So obstruction of the lungs with phlegm is a well-written pattern, right? So you might look at what herbs can I use for this patient, right? And then what acupuncture treatments can I use? What exercise program can we do? What kind of breathing exercises can they do? Something like that. And then you start to formulate your treatment principles, right? And your protocol. So something chronic like this, you're just looking for maybe get some relief, some improvement, and then you can gauge it as you go, right? How you're going to follow up.
Then if we turn to acupuncture specifically, so I think if you just mentioned Chinese medicine to the lay public, most people think of acupuncture. That's kind of a characteristic response. And what is the theory behind how the needles affect the body and provide relief of symptoms or treatment of diseases? So, when we do a surgery, we kind of have this idea of what you're doing, whether you're doing releasing a nerve that's entrapped, or you're removing a tumor, or you're, taking out a gallbladder. Those are pretty straightforward types of, this is what that procedure is doing.
Right.
What's the general theory behind where you put the needles and how the needle interacting with the body results in a change?
Yeah, this is a question everyone, how does it work? It's one you get all the time, and it's a difficult question to ask because to understand, because you have to understand the foundation of how would it be perceived 1,000 years ago, right? 1,000 years ago, we're still 3,000 years into the medicine. So the idea of why they use it and what it does to the body may be understood in different ways, right? So if we look at fMRI scans of when we do acupuncture in the brain and what's going on, now Western science is great at telling us what's going on internally, and we can see deeper, oh, this is why it works, or this is why it works, we're activating this, right? Which is incredibly amazing information. But if we look at how do we practice, that's not really how we practice. And it may have some overlap now, right? Eastern and Western are definitely overlapping. And China is right in the forefront of that because this medicine is completely integrated over there. They've had an easy time integrating it. So they have the Eastern and Western approach. When we formulate an acupuncture formulation of points, we're looking at what organ systems are we working on, right? So each acupuncture channel that goes through the body has different points on, and they all go back to different organ systems. The simple answer is the body naturally heals itself, right? So just if you were to scratch your finger or cut your finger, your body automatically starts healing. So if I put a foreign object into your body, it's going to see as an invader, and it's going to try to heal it, right? It heals the injury site. So if we look at it real simply, we're just creating minute injuries to the body and making the body heal it, right? And we can manipulate that process, right? So to understand how that works, there's a classic saying in Chinese medicine that says, if you have a headache, treat your feet, right? And we're in Western medicine, if you have a headache, everyone comes in, they're like, oh, my pain's here. And I put the needles on their feet. And then many of them are like, did you hear me? It's up here. So understanding the environment within the body, we're creating harmony, right? If there's too much going on in the head already and I put needles up there, it's going to make it worse. But if I put needles in the feet, then I attract that healing energy that the body naturally has away from the head. The body's trying to treat something up here, right? And it could be causing that pain. If I put it in the feet, it pulls that away and lets that relax. We know that the body can only treat the most acute thing that's happening. And a needle stuck in your foot is the most acute thing that's happening. So it shuts those other pain symptoms off, right? But how do I treat fertility and migraines in the same way? How do I treat dermatological disorders in the same way? I'm treating eczema the same way I'm treating a migraine, right? Because I'm treating the underlying pattern of it, right? So I think that's the genius part of it. That I'm not just treating the headache, I'm treating the whole patient. Yeah.
Let's go to cancer. Is there any thought that Chinese medicine cures certain types of cancer?
Oh, cure's a tricky word.
Mm-hmm.
You can say remission, right? Because um, if I it's like this: you have a garden, right? And you go out and pull all your weeds, and say my garden's cured of weeds. I don't need to come back for the rest of the summer, right? All those weeds are going to come right back if you don't change the reason it's happening in the first place. If you don't get to the root cause of it, it's not going to stay away, right? So I think looking at what is the root cause of it, why is it manifesting in that person, and how is it manifesting? So you don't say that you cure it. We don't even say that we treat cancer, right? Technically, legally, you can't. Technically, in China they may say that, right? They may say that with herbs, acupuncture, they might treat cancer, but it's more you're treating the patient.
Yeah.
Yeah.
And that's kind of what my thought is. So when I send a patient to explore acupuncture as a remedy, I'm thinking of it as a healing process, not so much to kill the cancer cells, but to help manage symptoms that might be symptoms from the cancer, or probably more commonly, there's symptoms or side effects from the cancer treatment.
Yeah.
And let's say peripheral neuropathy,
Mm-hmm.
or some sort of stiffness and limitation of movement based because of scarring from either surgery or radiation. So I'm usually, when I say let's try getting you to see an acupuncturist, it's just more symptom management than treating the cancer.
I think understanding the role at this point that Chinese medicine has in connection with Western medicine, right? As a complementary medicine, I think that's the best term to use, because Western medicine is a physical medicine. It's very mechanistic, right? And it's very good at eradicating major things from the body. It's very fast, and it's emergency medicine, right? Where Chinese medicine, it's about harmonizing the body and treating the body, right? So it's more for balancing that out, and it's a wider perspective of the body. It's not looking at the detailed cellular activity so much. It's looking at how is the body performing on a whole, and in that they're really good at making the body stronger, right? Western medicine, the treatments can be very draining to the body, right? And you will have lots of side effects because you're treating aggressively, quickly, right? And in many cancer cases you have to, but that creates side effects, right?
I'm glad that you started off talking really about the philosophical and how the philosophy of China is part and parcel of this balance. When you think of the yin and the yang, and the using force against itself, and getting out of the way, and the way that the Chinese philosophical concept of balance is so important. You shared with me before we started the interview that as part of your training, or right after training, you spent a year with a practitioner of Chinese medicine that was taking care of cancer patients. Maybe talk a little bit about that year, and then we'll get into where do you see the role of Chinese medicine in cancer care, either as part of the treatment as patients are going through Western treatment of cancer, or in helping to provide healing and symptom relief maybe after cancer treatment.
Yeah, I was like I said, I was really lucky to have the opportunity to be granted an internship with a senior practitioner in the Bay Area, San Francisco Bay Area. She had her name was Beverly Burns, and she had started 2 clinics that were free clinics for women of poverty with cancer. So all the treatments were free, all the acupuncture, the herbs, the counseling, everything was free. So I got to put the herbs together. I got to be around and do some of the moxibustion treatments, and got to trail her as she saw patients. So, maybe the course of a year I was there, and it was really an amazing experience to see how you're looking at the patient's whole life, right? How can we assist the patient in their whole life? Like I said, Chinese medicine is not necessarily you take a pill and then you don't have responsibility, right? You don't go get your acupuncture and then go home and do whatever you want. The practitioner has to guide you into how is a more balanced life going to help your current situation. What does a balanced life look for this patient? What does their food look like? Where's their mind at? Where's the emotional state of the patient? Where's the physical state of the patient? How can we work that within modern society and the stresses of modern society? It's very challenging.
Yes, and the
Yeah.
social determinants of health and
Exactly. So when we look at how does Chinese medicine play, it was a lot easier 1,000 years ago because there was no electricity, there was no distractions, everybody kind of ate the same food, right? It was all in a smaller village. So now we're a society of excess, so we have everything available to us. And the disease patterns that we see within Chinese medicine are more of excess conditions now, right? The body's kind of has too much going on. So understanding the role of Chinese medicine today with the modern cancer patient is, we see a lot of things like anemia or nausea, vomiting, pain, low blood counts, right? So they've been long researched in Chinese medicine. So using foods and herbs to treat these symptoms, right?
Mm-hmm. And many of the conditions you just mentioned may all be manifestations of the treatment they received,
right?
Not manifestations of the actual disease,
right? It was 2,500 years ago. They were already writing about breast cancer. They called them breast stones, right? And they had treatment methods for those: topical treatments, internal treatments, food treatments, acupuncture. So they have a long history of treating in that way. When you combine it with Western medicine, it can be extremely powerful, right? And what I see with a lot of patients is maybe they're so exhausted from the chemotherapy treatments they can't even continue treatments. Chinese medicine has a really amazing ability to build that, what we call the zhengqi. Zhengqi is like your upright immune system, right? It's the force that fights off disease, right? We call it our immune system. So they spent so much time and energy on building that's really supports the modern cancer patient, right? Can really build their blood cells back up, can build their immune system back up, build their digestion up. And so we see through digestion and the air we breathe, if we can build those up, they get stronger and they get stronger, and their body's able to fight that off.
Let's get real specific.
Mm-hmm.
Let's talk about two different entities. And let's say someone comes into your office and doesn't really understand the whole Chinese philosophy and the balance, and they come in because they've got a particular symptom that they want you to address.
That's most of them.
So we're going to talk about two. One would be lymphedema of the arm on the side that a woman had breast surgery and radiation. Mm-hmm. And another would be a gentleman who went through lung cancer treatment and has peripheral neuropathy of the hands and the feet.
Mm-hmm.
So
the first patient, we don't needle the side that the lymph nodes were removed, right? So one thing about Chinese medicine is we have local points and distal points, mm-hmm. right? So
let me just ask, so is that in deference to the Westerners who would say, don't mess with this arm?
A little bit of both.
Or
a little bit of both.
Like in 1,000 years ago, if you didn't have a Western doctor saying, don't stick a needle in this arm, you might have stuck a needle in that arm. I mean, I'm not saying that would be a wrong thing to do, but probably many people.
They wouldn't have been taking lymph nodes out, back then. So you wouldn't have had the issue. Right. But there are things you don't want to needle. Hmm. So when a condition is more acute, or a condition is more replete, we might say, the further away the needles are going to be. So let's say there's an inflammatory response going on in that area. So we put needles in there, we're going to cause more problems.
Sure, but we're saying it's 5 years after the surgery and it's a
chronic condition. So what we do is we work through the organ systems, right? So what organs are responsible for fluid metabolizing, right? What organs are responsible for moving the fluids through the body? So we have the lungs, we have the spleen, and the kidneys. So it's important to understand when we talk about organs, we're not talking about biomedical organ per se. We're talking about the physiological system within Chinese medicine. What is that kidney system responsible for it and the totality of it, right? So it's responsible for growth, reproduction, aging, hormones, hearing, head hair, all these things, right? So when we talk about the organ system, everything that it encompasses, we're working on. And it treats the bones as well. The kidneys are responsible for the bones in Chinese medicine. The spleen is responsible for the transformation of the fluids, right? So our digestive properties. So if we would transform the fluids better, then the lymphedema won't be as severe. So when we needle the body, we're working on those, not necessarily the arm itself, right? We're working on the whole body to transform it, because it's an enclosed system, Does that answer that?
Yes. And then how about peripheral neuropathy?
Yeah, peripheral neuropathy. So I see a fair amount of that, both for many different reasons.
You can have diabetic
Yeah,
peripheral
yeah,
neuropathy.
I see.
You can have just basically neuropathy
neuropathy.
of aging.
Yeah, we see quite a bit of it actually. So acupuncture does really well with neuropathy because it stimulates the nerves, right? So they know now how that happens with acupuncture. We can put the needles along the channel, along the spine where the nerves come out. We view the body many different ways. We view it as maybe musculoskeletal, or we might view it as organs, or we might view it as fluid pathology, right? So we diagnose on different levels. Neuropathy, we may just take it more from a physical standpoint, just run the channel with the needles down and stimulate all the way down. We might have to see if there's underlying constitutional deficiencies or excesses that are leading to it, like in diabetes, right? Or does the patient have those underlying deficiencies or excesses before they went into their chemotherapy treatments? Or has the chemotherapy now caused some of those constitutional imbalances that we need to address to help nourish the nerves better, right? So everything's nourished through the blood in Chinese medicine. So creating that circulation and that strength through the blood, right, to nourish the nerves to help them heal.
And what other conditions have you treated successfully in patients who also have a cancer diagnosis? So I'm saying they may be in the midst of cancer treatment, or they may be cancer survivors that are cancer-free.
Mm-hmm.
What are some of the conditions that you think you have a really high level of success?
Well, I think there's a lot going on in the broad picture of the cancer patient, both emotionally and physically. I think one of the things that Chinese medicine is excellent
And philosophically.
And philosophically, you're looking at life. And I think one of the things that Chinese medicine is really good at is regulating the emotional state, the psychological state of what's going on. Because we know that acupuncture helps release endorphins, it helps relax the mind, creates a relaxed state of the body temporarily, right? And if we do that over and over and over, then the patient maybe starts to sleep better. They get better sleep, then they feel better through the day, and then the body gets stronger. So I think not only in the physical realm, but also in the psychological realm, Chinese medicine is very successful at. You'll see patients with pain, like from surgical sites, right? We'll treat a lot of that. We'll treat a lot of internal organ problems, very successfully with nausea, vomiting, lack of appetite, stuff like that. A wide variety of things. And it's also getting the patient to understand what we think of healthy in the East might not be thought of in the West, or what we think of healthy in the West might not be in the East, right? So a patient might say, well, I'm doing smoothies every day. I'm being healthy, right? I'm doing smoothies and salads, and I'm getting in all my fruits and vegetables, right? So Chinese medicine, that'd be the wrong diet, right? It's too cold. You're eating too many cold foods, eating food combinations we don't normally eat by juicing or by creating smoothies. We're eating out of season. If it's wintertime and we're eating salads, it's out of season. You want to eat locally. So if you're eating tropical fruit in Iowa in the wintertime, that's not what your body needs. You are a product of your environment, right? So to to nourish the body where it exists, right? So you want to, there's an interesting field within Chinese medicine that's extremely deep that all the master doctors have written books about called health cultivation, right? This is called Yangsheng. Yangsheng is a whole study within the medicine of how do I live in harmony with nature through the seasons? What do I eat? How do I think? How do I approach my community? How do I approach myself? And these will change throughout your life, throughout your phases of your cycles, right? And then through the year, it'll change. And then where you live, it'll change. So these are the guiding points that really help a patient become more balanced within that lifestyle.
So I could see a little bit of an issue. Somebody comes in and says, I get the swelling in my arm, and they don't know they're walking into like a life coach who's wants to help find harmony and balance, and they just want you to fix their arm.
Oh yeah, that's all they want.
So how many come back a second time when after the first hour you haven't fixed their arm?
Yeah, you can't throw the whole medicine at them. Yeah.
So how do you, Jay, approach a patient who doesn't have an understanding of Chinese philosophy and this balance, and they have a symptom that they are coming to you for help?
Yeah, in the beginning, when you're a young practitioner, you want to fix everything. You're like, oh, I see all the great things that could happen in you, and you try to do too much, right? And then when you start to back it off, you learn, well, okay, they just probably need to fix this, and then you just start planting seeds. We're going to work on this. You don't put too much.
You need to develop the relationship.
First. Yeah, that's the most important thing. One of the greatest quotes that I love is from a Chinese practitioner, Li Dongyuan. He says that a Chinese medicine doctor should approach every patient as if they were a family member, right? And every patient should see their doctor as a member of their family, because you need to understand them. You need to understand what are they doing during the day, how are they acting, why are they doing this, right? Most people, their diet, they're emotionally attached to, right? Their whole life might be built into it, through family, right? And they might be eating for emotional reasons. They might be medicating. We're all medicating.
And then, of course, there's just the habit of what you've been doing for 20 years.
Exactly. So how do you go about changing that, right? The patient might benefit greatly by taking dairy out of their diet. Might improve their condition greatly, but that's an emotional attachment. You can't force them to, right? You can suggest it and explain to them, this might benefit you, and then ease them into it.
So, Western medicine, William Osler quotation, good doctor treats the disease, a great doctor treats the patient. So a similar concept of whether it's Eastern or Western, that there's this whole person, not just, but I agree that Western tends to, what's the problem? Let's deal with that problem, and doesn't often get into a more holistic. You mentioned the word complementary. I totally agree that Chinese can be complementary to Western. We're tending to use the word now integrative, just meaning the same thing. So with the expansion of our cancer center, I'm bringing integrative medicine into the cancer center. So looking at bringing in all of these other forms of healing that, my Western trained way, maybe thinking, well, I'm not bringing these into the clinic because I think they're going to help us kill more cancer cells, but because I'm very interested in the whole patient, mind, body, spirit, that I'm thinking these other practices may help achieve that healing and wellness and improvement in quality of life, even if they don't, improve the cure rate of cancer.
Right, exactly. Yeah, I think in that you're going to be much more successful, right? Seeing the bigger picture of it. And that's why I say they work so well together, because Western medicine takes that small approach and we take the wider approach.
So tell me about some patients that you feel you have changed their lives, helped improve healing and quality, whether it's a cancer patient or not, but maybe it's just some examples
Yeah.
where you've had a dramatic impact on the lives of patients.
Yeah, that's a big one.
Just choose one patient.
Well, I think the fun part is that you're there because you care, right? Because your heart's in it. Or you don't follow Chinese medicine because it's something you picked up at school. You follow it because you're passionate about it. And most people that go into this field are extremely passionate and caring. And it's interesting because Chinese medicine, to follow up on your quote, there's a quote that says the average doctor treats disease before it happens, or treats disease after it happens, where the superior doctor treats disease before it happens. And Chinese medicine has been saying that for a long time. So you see, that they're there to, how do I want to say it? When you want to use that actually first, right? You want to live your lifestyle in such a way that you're preventing the disease. So when a patient comes into me in the West, though, they've been through every Western testing. They've gone through all their labs. A lot of the times they can't figure out what's wrong with them, right? And they're just at their wits' ends, or they don't like their options at that point, right? And Chinese medicine usually has an explanation for it and can often be very successful. And when you see patients change, they're like, I thought I was going to be stuck with this for the rest of my life, or I've had this condition for 20 years, and you changed it within 6 months, and now I don't have it anymore. You see them light up, like they have a whole new life. It's amazing, right? And like I said, I see all different types of disorders. So skin disorders that people have had for 20, 30 years, and they come in, and with a few months, it's completely gone. Or fertility patients, cancer patients, right? Pain patients. I've had people come in with migraines that they've had every day for years, and you put one needle in and it goes away. And they don't know what you did. They're amazed, right? And you're kind of amazed. And you're like, wow, this stuff works. And it's just a really cool feeling. It's really amazing, to be part of that.
So you mentioned fertility, you mentioned headaches. In terms of cancer patients, either symptoms from their cancer or symptoms they're having as a result of cancer treatment, what are some other examples of cancer patients that you have treated where you feel like you've improved their healing and their quality of life?
I'd say the most common thing that I see for patients like that is their digestion improves, that their strength improves, right? And that their peace of mind improves, right? Usually when they come in, they have that fearful, scared, worried look, and it takes a few treatments, and before you know it, they're coming in smiling, and they feel relaxed. And when they leave, their body's completely changed, right? We always say that they're walking out with acupuncture brain, because they are in this different state, and that really helps them to find that balance in their life again,
So I'm going to ask you a question that probably comes from a Western perspective, so the question maybe isn't even fair in the Eastern perspective. But so there are practitioners of acupuncture who don't have considerable knowledge of herbs. I mean, you can go to an acupuncture training. To what extent do you think acupuncture versus diet, what you're eating for your nutrition, versus herbs as supplement or medicine, and that maybe not the right way of thinking of it, but is it all of that for everybody, and that we probably all should be doing that, as just like we brush our teeth every day, we don't wait till we have cavities to do it. I understand that some of what we call Chinese medicine is really just a way of life that helps prevent disease.
Right.
But would you?
Yeah. So the idea is that it's very complex, right? You're right. To get in the state of Iowa to be a licensed acupuncturist, you don't have to study herbs, and it's not necessary for your boards or your exams or anything like that. My school was heavily steeped in herbs, and it was one of my passions. We're the only clinic in Iowa that carries a full raw herb pharmacy plus pills and powders. So I see a lot of patients coming from all over the state who have knowledge of herbs. I think Chicago is where most of them go after us. it's a very complex way of practicing, you know, thousands of herbs that are used by diagnosis and then formulated together and then modified, right? Um, Not an easy thing to do. So some practitioners don't even get into it. You know, it's much easier for them to do acupuncture and food therapy. You don't want to take herbs the rest of your life. In Western medicine, you might have to take a pharmaceutical to keep you alive for the rest of your life, right? Herbs aren't that way. Food's not that way. You want to treat the condition as it's happening, right? And once the condition is resolved, then you can stop the treatment, right? So you wouldn't want to be on herbal formulations for the rest of your life. You want to use food first, right? That should be your main medicine. The second, then if food doesn't work, then use the herbs. And that comes from John Zhongjing a couple thousand years ago. First use the food. That doesn't work, use the herbs, right? So if I give a patient all these great herbs that I spend hours coming up with and it's just genius, and I give it to them and they go home and eat ice cream and pizza, it's not going to do anything or it's going to slow it down, right? So understanding we can all gain from that knowledge, right? We can all gain a few things here and there. Well, maybe I shouldn't eat cold stuff in the wintertime, or maybe I shouldn't eat salads. You know, it just helps your life out a little bit better. There's such deep wisdom there. How do we translate a lot of that cultural stuff into our culture, right? To help us benefit and stay healthy and prevent disease. I think that's the difficult part of it, because it's language based, it's cultural based, it's food driven, right? So that's the trick of it. So I'm lucky that I live here, that I grew up here. So I understand the culture.
Yes.
Right. So how can I translate that? A lot of my job is how do I translate Chinese medicine into the culture here? Yeah.
We're going to go to our live studio audience here and see if we have some questions.
Yeah. Does insurance cover acupuncture?
So let's talk about the business model of acupuncture and Chinese medicine. So,
Okay.
you know, in the Western world, I click a box for the CPT code of what I did, and somebody sends a bill off to the insurance company, and the insurance company reimburses. How does it work in your clinic?
It's getting there. It's really close to that now. So a lot more insurance companies do cover acupuncture. It depends on the plan that you have. You know, I know there's some corporations in town that provide it for their. I know Wells Fargo is good at it. We don't currently bill directly, so patients will pay at the time, and then we'll give them their billing codes and the super bills, and they get reimbursed. Some of it we are set up to start billing next year or sooner. Medicare just announced last year that they're going to cover acupuncture for low back pain. So that's the first thing that they've said they're going to cover acupuncture for. So there's a whole process of who they're going to cover, the practitioners, but that's underway, which is really important. So
we're getting there. But right now, you would say that someone who comes to you will pay out of pocket, and that then they would seek reimbursement, and they may or may not be successful depending which insurance company they have and who their employer is. And so, and that has to be a barrier to people seeking you.
For the patient, it can be a little taxing because it might not be affordable for them. So in my clinic, by not taking insurance currently, I'm not controlled by the contracts, or they don't get to dictate my fees and stuff. So I will often do packages, or say give discounts to people, because they might not be able to afford it. It's more important that they get treated, right? So we want to make it sure what's going to work for them. How are they going to get treatment, right? And we've done community acupuncture clinics over the past years, where people will come in and do $25 acupuncture. They're all in a larger room together, you know. So we try to make it affordable for the community. So, yeah.
Other questions?
You mentioned like a local, same with acupuncture here. You mentioned like a local acupuncture versus non-local, and you gave a good understanding of what non-local is. But can you give me an example of like a local acupuncture that you would do?
Yeah, so this is interesting. This is something that we've been kind of dealing with our profession. When I was in school, 20 years ago, physical therapists started doing dry needling, right? And so what dry needling is is you take the acupuncture needle and you insert it into an active trigger point. Now, all trigger points are acupuncture points, but not all acupuncture points are trigger points, right? So what it is this is a nodule in the muscle band that we can go through and manually stimulate till it releases and then opens it up, right? So that technique has been around for 2,500 years that they've been writing about it. So what happened, over the past 20 years is they renamed acupuncture dry needling, so they don't have to go through all the schooling, and it's just one technique. So that would be a local technique where I'm going in and I'm manually treating a muscle in that area, right? So
Treating where it hurts.
where it hurts.
Yeah.
Yeah. Releasing that muscle might get quick relief, right? So that would be a local site.
Okay. Other questions? Yes.
Preventative health care, is that one of the most important attributes of the Chinese medicine?
I would say so. I think, like we said, we want to prevent disease before it happens. There's an old Chinese saying, don't start to dig a well when you're thirsty, right? Don't sharpen your tools when the war's already begun, right? All these old Chinese sayings, we want to prevent disease before it happens. They say that a Chinese medicine doctor will save your life, but they'll do it 30 years in advance, right? Because if they see you going down this path, we understand that the body's naturally going to have these problems, right? If we can get you back on that centered path, then you're going to be able to alleviate a lot more problems.
Mm-hmm.
So understanding the patient, like you said, you have to understand the patient and their tendencies and where they're going, and then where do they need to be. Yeah.
And find the middle way.
And find the middle way.
Well, Jay, this has been great. Thank you for talking to us about acupuncture and Chinese medicine in general.
Thank you.
So I've learned a lot tonight.
Yeah, thank you.
So thanks everybody for attending the Cancer Education Series sponsored by Mercy Cancer Center and Above and Beyond Cancer. Please come back and join us next week. If you would like to see this program again, or if you have friends or family members you would like to share this with, this video podcast will be on the MercyOne Cancer Center website, and it will also be on the Above and Beyond Cancer YouTube channels, so you can watch it again. Thanks a lot. Bye-bye.